Are you an everyday woman?
We're back to continue the conversation on breast reconstruction. Dr. Kapoor.
Yeah, so I wanted to get into mastectomies. You know, the next thing, if a woman either needs a mastectomy because of the size of her cancer, or if she wants a mastectomy to reduce the risk of future cancers, then the best tool is having my plastic surgeon with me.
What is a mastectomy?
Yes.
Okay, step number one, right? What is it? Mastectomy means removal of all the breast tissue. So it usually included the nipple and the areola and some of the skin. Nowadays we do things called skin sparing, so we save the whole envelope of the breast, as well as sometimes nipple sparing. And
what happens if you can't spare the skin and the nipple? I mean,
so that's
what's
where
there?
the reconstruction sort of takes over. So, you know, the treatment always begins with what's the safest plan for the patient. So even though we can save nipples today, we have to selectively use it on patients who are good candidates. So it starts with safety. So for a patient in whom we cannot save the nipple, Dr. Kapoor would remove the nipple, she'll remove a certain amount of skin, and then all of the breast tissue. Then my job is to come in and recreate the volume of the breast to stretch the skin back out so that the mastectomy side now matches the unoperated side, and then if the nipple has been removed, to rebuild it. And we'll show you examples of how that works.
You said good candidate. What qualifies a woman being a good candidate?
So it's a good question. There's two parts. So
there's a cancer part, right? Yeah. So number one is cancer, right? Is the cancer right under the nipple? Okay. Then we shouldn't save the nipple. The goal is to remove the cancer, prevent it from coming back. So number one, is the cancer too close to the nipple? If the cancer is very large, there's more likely it's going to be spreading to the nipple. Okay. So cancer number one. Number two is the cosmetic part.
So number two would be, there's certain breasts that are easier in which to save the nipple. So if somebody has a smaller breast, that means you only need a certain blood supply to keep that nipple alive. If you have a very long, large breast, the blood supply after the surgery is going to have a harder time keeping that tissue alive.
Okay,
so
I am blown away. What do you mean? So keeping the tissue alive once it's off my body? Well, this is wild. This is beyond me.
The way I think of it, you know, mastectomy is going to go in and remove the breast tissue. Yes. But in the course of doing that, lots of people are aware that after a mastectomy, patients feel numb. Yes. The reason people feel numb is because a lot of the nerves have been removed or damaged. Well, another thing that happens during the mastectomy is that the blood supply can get damaged. Well, every part of your body that's living needs blood flow to stay alive.
Correct.
So the question is, at the end of that mastectomy, how much of that skin can your body keep alive through blood flow? If you have a very large breast with a lot of cells to keep alive, it can be much more difficult to keep all that tissue alive. Yeah. In a smaller breast with less tissue, it can be easier to perform that surgery.
Right. So when I remove the breast tissue, usually the blood flow comes through the breast to get the nipple and the skin as well. Once I remove all that, it's up to whether or not the breast is small enough to allow for the blood flow to come through the skin and reach.
Wow.
Right? So a long breast has a longer blood supply, a longer way to go to reach the nipple. Or a small breast is a shorter distance to go.
Okay. So you removed it. We got that. Yeah. So what
what
happens next?
So let me show you what that looks like. Yeah. So this is a patient who's had a mastectomy. Some people have seen patients like this, others haven't, but this is a woman whose breast has been removed, and in her case was not reconstructed.
Not yet.
Not yet.
Okay, so is this flat? I know you can't tell. Is it just a flat, or is there?
If we're not going to do a reconstruction, then yes, the breast surgeons, they take out all the volume of the breast, and they also remove as much of the extra skin as possible. A patient like this who decides maybe not to have reconstruction often will wear prosthesis that they'll put into their bra. So what you want is a flat surface for that prosthesis to sit on.
Why would a woman choose not to reconstruct?
Well, I think it's deeply personal. So I think every woman answers that question in her own very private way. You know, for some women, they can't think of the idea of getting out of a shower and looking in the mirror and not seeing a breast. For other patients, maybe they've reached a point in their life where it's not as important.
Some of it is education. I mean, when my patients say, no, I don't want reconstruction, I say, you know what, please go speak with Dr. West, go speak with one of the plastic surgeons, hear about what it's all about, because there's some misconceptions. They don't know what it means, what's going to be involved.
Right. And then the thing I would this is a patient, for example, that you think has had a very disfiguring surgery, but if you put that next to a patient like this is also a breast cancer patient. This is not a breast augmentation patient. This patient had both her breasts removed. Her nipples were saved. She has very small incisions just at the top of the areolas, but those are both reconstructed breasts. And this is a patient who actually tells us every time we see her that she likes her breasts more after her surgery than before.
Wow. I don't blame her. They look really good.
Wow.
So that's
done.
Well, yeah, I was going to say
well done.
Okay, so this is before, and then this is after. She had both of these removed, so she looked like the lady before that had the flat.
In her case, no. That was a patient who elected not to have any reconstruction. For a patient like this, what she went through was the day of the mastectomy, Dr. Kapoor finishes her surgery, they give me a call. I come into the room, the breast tissue's been removed and the skin is deflated, but the skin is all there and the nipples are there.
Okay.
So I put in a device called an expander, which helps to stretch the skin back out, and then about 3 or 4 months later, when she is the size that she wants to be, we put in her permanent implants.
Okay, wait, so that took 3 or 4 months to get to that size?
Well, there's a number of factors that go into it, but on average, it's about 3 or 4 months from the day of the mastectomy to the day they get their final implants, but there's steps in between.
Okay, I want to know about all those steps when we come back. Stay tuned.
Are you an everyway woman?